just a little history here. We've tried for some years. Our group's over 20 years old, and I've been in the group for, I don't know, 10, 12 years, leading it for about 10. And at least 4 or 5 years, we started wanting to get an acupuncturist to speak, and we contacted a number of them. And the problem is that we always met in person on the first Saturday of the month, and the acupuncturists were working then with clients, so nobody could really come and speak to us then. So we have to thank the pandemic, I guess, for getting us Bill. And I think, if I'm not mistaken, out of the thin air, I think he contacted me, or he heard, I think Bill, didn't you say you saw us somewhere in some notes thing or something about the support group?
Yes.
Yeah. Okay. Where was that? In Virginia?
Yes, but I don't recall the exact publication.
So I was delighted to hear from him. Bill has an outstanding background here. His background includes both traditional Chinese medicine and Western medicine, over 20 years experience as an acupuncturist. He currently practices at Inova Fairfax Hospital, where he treats cancer patients who suffer from PN. And we've had at least, I don't know, I'd say a dozen members over the years who got the neuropathy from chemotherapy. And Bill, he thinks maybe that's one of the most effective treatments, acupuncture, for chemo-induced PN. It may not be as effective for idiopathic, which many of us have. And I want to ask him about, does it help at all with numbness, not just pain? But his background includes a variety of elected positions. He was president of the Acupuncture Society of Virginia, director of the American Association of Acupuncture and Oriental Medicine. This is like the AMA of acupuncture in America. He's the author of more than 150 publications. He serves on various editorial boards of national peer-reviewed medical journals. We sent you out his website. He also sent us, and we sent to you, some articles for background, including, I think there are 4 of them that you can read if you haven't read yet at your leisure. Acupuncture for chemo-induced PN, an additional 8-week study with 87 cancer patients, and a study focusing on lower extremities, which might be of interest to us who have numb feet or numb legs. So without further ado, I'd like to turn the floor over to Bill for about 20 minutes, and then we'll have some questions. Bill, thank you for coming.
No problem, Steve. Thanks for having me. I know that PN is a very frustrating condition, and Western medicine is kind of weak in dealing with it. So I'm going to share my screen, and let's see if I can get to the PowerPoint. Okay, so what I'm going to do is first talk a little bit about there may be people in the group that don't know too much about acupuncture, so I'm going to quickly go over when it was first introduced in the US, some frequently asked questions, and talk a little bit about the peripheral neuropathy research. But the big thing I want to do is be able to answer your questions and just find out what specific questions you have of me. So many times people ask, well, what does acupuncture feel like? Does it hurt? What conditions does it treat? What can I expect in a treatment? Does insurance cover it? What are the needles made of? Is there a license required? What is herbology? So it was actually first introduced in the US back in the 1800s, and when we were in the process of building a transcontinental railroad, actually. And there were Chinese immigrants that were helping with the labor force, and they were actually doing acupuncture. But when it really was introduced in the country was when Nixon went to China, and he had a guy, James Reston, that was with him, who was a journalist for the New York Times, and he suddenly had a very bad appendicitis and was going to be flown back to the US, but the flight was so long, he underwent surgery in China, and afterwards he had quite a bit of nausea, which back then was not unusual after anesthesia. And an acupuncturist came in, put 3 needles in him, and within 15 minutes, his nausea vanished, and it was like magic. And so he wrote an article about acupuncture, and that was the first time that the US really was exposed to it. As far as education in the United States, we require 4 years of undergraduate work, then a year of medical prerequisites, 3 years of school for acupuncture, 2 years of school for herbology, and a year of internship.
Wow.
The clinical requirements are basically a year of internship, as opposed to an MD that has to do 2 years. And the degree conferred is an OMD, which is a Doctor of Oriental Medicine. It could be a DOM. Sometimes we'll have L.Ac after our names, like I do, which is a licensed acupuncturist. And the current entry is a master's level program. We do have doctoral programs now, but when I studied it, we did not. Here's a list of some of the conditions that we treat, and that I'm happy to give this whole presentation to Steve so you don't have to worry about writing anything down. And this is 30 years old. The list is from the World Health Organization when they, along with NIH, looked at acupuncture as an acupuncture consensus statement. And based on the double-blind placebo-controlled studies at that time, they found that acupuncture absolutely had a positive effect on colitis and indigestion, diarrhea, constipation, diabetes, deafness, etc. Like I said, the World Health Organization, along with NIH, had worked together in the acupuncture consensus statement back in 1983. And so this is quite old, but it does list some of the conditions that they found through science that acupuncture treats. Since that time, there are now 30,000 studies at NIH for supporting acupuncture use. And so you can see here neuralgia, sciatica. They have Bell's palsy. They don't actually have peripheral neuropathy at the time that they created this list. You can see urinary and reproductive issues, PMS, vaginitis, irregular period, all of which I've treated. Anxiety is a big one in Northern Virginia. Depression, stress, insomnia I deal with pretty regularly. We also deal with infections, and there's actually protocols in China for the coronavirus, and we've actually helped reduce the number of deaths in China due to coronavirus. But there's more of an herbal combination that works more effectively than acupuncture alone. So what can't acupuncture treat? You know, HIV and AIDS is something that just we can't touch. Cancer and tumors, acupuncture will not improve. Structural problems like scoliosis, disc herniations. If someone has a disc herniation that's pressing on a nerve, but there's inflammation involved, I can treat the inflammation and then the discomfort will vanish. But all the little needles in the world aren't going to move a disc back into place. A spinal stenosis is something that's very stubborn, and I've heard of acupuncturists that have had positive results. I have not, and that the studies haven't said positive results as well. Kidney stones, again, we can reduce the pain associated with kidney stones, but can't actually get them out of your body. We do tongue diagnosis, so we look at tongues, which is unusual. Sometimes you'll have dentists look at your tongue, but that's something that's part of our diagnostic method. We do pulse diagnosis, where you have 3 pulses on each wrist that correspond to different organs, and there are 34 qualities of pulse that we look for. It seems highly unusual, but that's the ancient Chinese secrets. What does it feel like? Does it hurt? The needles are 4 times the diameter of a human hair, so they're quite small. They're stainless steel, used once and discarded, so there's not a chance of any kind of infection. And if you've had a mosquito bite, usually a mosquito bite hurts more than an acupuncture needle. If there's anyone in the crowd who's had dry needling from a physical therapist, that's actually quite painful, and they're fishing the needle into a muscle trying to get to the neuromuscular junction, and when you do, it'll twitch or fasciculate, and that's not comfortable. If any of you had a EMG, electromyogram, That's something where they use needles very slim, like acupuncture needles, and stick them into your nerve, and that's also quite unpleasant. So this is a typical acupuncture treatment according to Hollywood. And so Hollywood kind of gives us from the Matrix, just in case you recognize it. And so Hollywood gives us kind of a bad rap, and people think when they come see me, I'm going to put 400 needles in them, and I put 3, maybe 4, and so they're a little bit disappointed. So again, just the popular media tends to portray us as just sticking people with lots of needles. What can you expect in a treatment? Normally it's an hour and a half for the first visit. About an hour thereafter, the needles are retained or kept in your body for about 20 to 30 minutes. And once the needle's in, you don't feel it at all. You can move around, you just don't feel it. Will my insurance cover acupuncture? This is quite an old study back in 2004, but at that time, about 50% of employers were covering acupuncture benefits. In Maryland, it's considered a essential health benefit in the Affordable Care Act, Obamacare, which means 100% of insurance companies will cover acupuncture in Maryland. However, Blue Cross Blue Shield will only cover it for low back pain and a few other things, nausea due to chemotherapy, etc. So they narrowed down the conditions that they're willing to cover just to not have to pay out, which is criminal, but that's the system we live in. So I mentioned that the needles are made out of stainless steel, and they're sterile and used once and discarded. And different states have different requirements. To practice in Virginia, you have to graduate from an accredited institution, have a national board certification, minimum number of biological sciences, 500 hours of internship. And to maintain our licensure, you need 60 continuing education units, so 60 hours of study every 2 years. And at this time, sorry, this is a little bit old, there's 47 states that have independent practice statutes in the United States. We're primary care in several states, including California. And at this time, it's North Dakota, South Dakota, and Oklahoma. So Kansas, Alabama, and Wyoming do have, you can practice acupuncture. So in a clinical survey, you can see that 91% of acupuncture patients reported disappearance or improvement. 84 says they see their MDs less. 80% use fewer prescription drugs, and that's my goal as well. I definitely like to have patients who are on less drugs rather than more. There's studies showing that if you're on 6 or more medications, you have twice the chance of dying of someone your age. So it's a slippery slope. Drugs are quite dangerous, and they have not only side effects, but they also have interactions which can be problematic. And interestingly, at the bottom, almost 70% said, I get along better with others through acupuncture. And that's because we are able to reduce cortisol, which is a stress hormone, and people become less reactive. At this time, there are about 65 schools in the country that teach acupuncture. About 8,000 students are currently enrolled, and there are about 38,000 practitioners distributed across the nation. Most of us actually practice in more urban areas. So for instance, we have a little over 300 practicing in Virginia, and most of us are in the Northern Virginia area, huddled a little bit around Richmond, but pretty sparse when you get down to Blacksburg and other small towns. There are almost 1,000 of us in Maryland. And the reason why there's more of us in Maryland is because the practice statutes were a little bit tough in Virginia 20 years ago. And since that time, we've been able to change that. So people always ask, because they're Americans, how does acupuncture work? Mm-hmm. And here's a simplified diagram of how it works. as a neurologist sees it. And I'm not even going to begin to explain it because your brain would hurt and so would mine. So the point I'm trying to make with this slide is the fact that scientists are still trying to figure out how acupuncture works on a global scale. There are a bunch of different theories, but just like with Einstein using his entire life trying to come up with that grand unified theory where he was always trying to connect the very, very large, which is cosmology, the universe, with the very, very small, which is particle physics. And he was never able to do that. The strong and the weak forces being gravity and the strong forces being within an atom. So the point is that, for instance, if a woman is not ovulating, I can get her to have children and ovulate. But that is more neurohumoral or hormonal, whereas pain is something that is actually endogenous opioids in our brain that's released. And so you can see they talk about pain control here. They talk about the endocrine path, all of which are from the hypothalamus, which is a basal brain structure. Now, I won't bore you with the details. I will mention some pretty pictures here. You can see that someone had some pretty terrible neck pain, and it was inflamed and hot with this infrared image. And within 20 minutes, you can see, sorry about the last part over here, but it cooled down considerably with acupuncture. And the funny thing is the acupuncture point bladder 40 is located behind your knee. So where we put the acupuncture needles, if someone has a blazing migraine, I stick the needle between someone's toes here on their foot. If someone has terrible tennis elbow, there's a point on the leg near their shin that I needle. So it's very confusing to the Western mind. Just try to go with it. I wanted to point out the difference between Chinese medicine and Western medicine is that Chinese medicine is aimed towards treating the cause. It has very few side effects. It involves the whole person. It relies on differential diagnosis. Western medicine tends to treat more of the symptom. It tends to have some pretty serious side effects. There are primary specialties. So people, a lot of times neurologists are looking at you as a brain and a spinal cord. And they rely quite on a lot of technology, lab tests, MRIs, blood work, which is valuable, don't get me wrong, but I'm more low-tech, high-touch. So to begin the research side of the discussion, understanding what a randomized controlled trial is important. And originally, the double-blind placebo-controlled study was the gold standard in studying things related to medicine. Then they came up with a randomized controlled trial where they take a group of 100 people, let's say, and they randomize them into two groups. And one group actually gets the intervention, which could be a drug, and the other group gets the pill, gets the sugar pill, the placebo, and then they see which groups do. And because it's double blinded, it means that not only does the patient not know who's taking a sugar pill, but the physician that's treating them does not know who's taking the sugar pill. And that way there isn't expectations from the doctor that may sway the results. So in the peripheral neuropathy research that I was looking at, there are 300 results using just the keywords acupuncture neuropathy in PubMed, which is at the National Institutes of Health. And if you look here at the curve, it's showing that since 1982, there's been quite a bit of more research done on acupuncture and peripheral neuropathy, obviously in the past 10 years. And the acupuncture treatment of peripheral neuropathy, it says a systematic review and meta-analysis. A systematic review is where they don't have one randomized controlled trial, but they look at all the randomized controlled trials and then amalgamate them and try to figure out what the end results are. And so that is really big. If you score well in a meta-analysis, you know that it actually works. And so everyone here already knows about peripheral neuropathy better than I do, so I'm going to skip this slide. So in a pilot study of 27 multiple myeloma patients, and again, this number is quite small when you're talking about real research, but the bottom line was that their neuropathic pain was significantly reduced, and their functioning improved within about 10 weeks of treatment. And this was published in 2014. There's another study that was done. Again, this is with chemo-induced peripheral neuropathies, and again, 19 patients, and they found that there's a significant improvement. Again, 9 weeks. Usually, the magic number is twice a week for 3 weeks, and then in terms of treatment frequency, so that's twice a week for 3 weeks, and then we would drop to once per week as the symptoms improve. And again, here's one with 6 patients, and about 83% improved. And this was studying nerve conduction. So there's different measures of outcomes, some of which they use quality of life measures in the patients. Sometimes they have both qualitative and quantitative. And quantitative would be an electromyogram where they're actually measuring nerve conduction. And qualitative is where the patient is saying, hey, you know, I can feel my fingers again. And here's the paper that I described earlier. And what they found, looking at a very large number of studies, let's see if I've got the exact number of studies here. So what they do is that they look at all the randomized controlled trials, and they make sure that there's something called a JDAD score. So there's certain parameters they're looking for to make sure that it meets certain criteria. And then they narrowed it down to 15 studies. And of those 15 studies, they found that acupuncture absolutely is effective at treating diabetic neuropathy, Bell's palsy, carpal tunnel syndrome. They didn't have enough studies on HIV-related neuropathies to say without question that it's effective. And they also didn't have enough studies in the idiopathic neuropathies to strongly suggest that acupuncture is effective. So again, just because studies aren't out there doesn't mean that it doesn't work. It just means that they don't have evidence of that. And the conclusion was basically that it appears to improve nerve conduction, both in sensory and in motor. So if those of you have weakness as well as sensory problems, either pain and or tingling, numbness, burning sensation, it's something that's very, very helpful. And finally, I just wanted to mention where I'm located, which is across the street from the Shar Cancer Center. So typically a portion of my time is spent seeing cancer patients, and then the other portion is at Inova Well, where I see anyone off the streets. But because of the pandemic and because of the patients who are potentially immunocompromised, I'm just seeing patients at Inova Well. So I may start back up with the cancer patients in September. It's hard to say at this point. But with that being said, I know I was moving kind of quickly, but I wanted to make sure that the bulk of our time is spent with me answering your questions. So it's all you guys.
Thank you, Bill. We appreciate your expertise and willingness to share it with us, and we're going to be opening it for questions. Michael, can you show me the grid view, please, so I can see who has questions?
I'm sorry.
I'm still, yeah, there we go. We're going to try to monitor 2